Aside from our previous video, there's still some information you need to know about spaying and neutering your pet cat. When to spay? To prevent your little one from going into heat, ideally, she should be spayed prior to or right around 5 months of age. The youngest a kitty should be before she's spayed is 8 weeks old. Little ones this young need to be at least 2.2 pounds before surgery, recommends the Ohio Alleycat Resource. Young kittens tend to bounce back after surgery pretty quickly. Of course, your feline friend needs to be in good health to go through surgery. If she isn't, your vet will tell you when she is ready to be spayed. Spaying. The spay procedure is a routine surgery in which your vet will remove the reproductive organs of your kitty. These organs include the ovaries, uterus, and fallopian tubes, according to the American Society for the Prevention of Cruelty to Animals. Your vet makes a small incision in your little one's abdomen to do this, after which he'll close the area with surgical sutures. In 7 to 10 days, he'll remove these sutures or they will dissolve on their own. During her recovery, your furry friend may have to wear a special collar, known as an e-collar, to prevent her from licking or chewing at her sutures and causing an infection. Considerations. Spaying your kitty prior to her first heat means you won't have to deal with any of the unpleasant behaviors associated with estrus. These include loud yowling, a constant desire to go outside, and urine marking. Her number one desire during this time is to find a male kitty to mate with, which is why she wants to escape outdoors. Spaying her between 2 and 5 months old means you won't have to deal with any of this. Plus, her chances of developing breast and ovarian cancers is reduced, as are her chances of developing pyometra, a potentially deadly infection of the uterus, according to the Kokomo Humane Society. Note that it's never too late to spay a kitty, so if you adopt an unspayed older feline fur baby, have her spayed right away, as long as she's not in heat. The recovery of spayed kittens. Newborn kittens are tiny and cute, but they grow up startlingly quickly. Many female kittens actually will have their first heats as young as 4 months. To spare your sweet little furball any possibility of pregnancy so young, you can consider spaying as early as 8 weeks old. Early spaying. You may cringe at the idea of spaying your very young kitten, but early spaying can be a helpful preventive measure, keeping female cats healthy and totally avoiding the potential physical toll of a very young pregnancy. The ASPCA says spaying, in general, is also beneficial for preventing serious ailments, think breast cancer and various uterine disorders. Early spaying will not alter the kitten's appearance as an adult. The ovary removal operation just keeps her from going into heat. It spares you and kitty the behaviors of a female cat in season, including excessive vocalization, urine spraying, and restlessness. Most importantly, it prevents pregnancy. The spay surgery is easy and safe for kittens and adult cats of all ages, although the ASPCA recommends getting it done early, from 8 weeks on, to prevent the heat cycle from ever occurring. Ask your veterinarian about the safety of anesthesia for wee kitties. In most cases, the little ones recover a lot faster than adults. Safety. The ASPCA says the spay surgery is no more painful or dangerous for kittens than adult cats. If a cat is elderly, veterinarian consultations beforehand are recommended for safety purposes. If your cute kitty is on the older side, say more than 5 years, check with your vet before scheduling anything. Immediately after surgery. Spaying your kitty is a surgical procedure. Your kitten will require some recovery time, usually 1 to 2 days. She will naturally feel a bit uncomfortable and sore after the procedure, so your veterinarian may prescribe safe pain medication. In some cases, the clinic or hospital will keep your kitty overnight to watch for unexpected bleeding or other problems. In other cases, kitty may be home within hours. Kittens may feel a little groggy and disoriented after spaying, but they usually shake off anesthesia faster than adult cats, sometimes within an hour. If your kitten is newly spayed, give her a relaxing, calm, and quiet sanctuary where she can recuperate in peace. Keep any other household pets far away while she recovers. Hello. This video is sponsored by BMX Pets. Are you looking for high-quality cat collars at an affordable cost? Check out bmxpets.com. Use coupon code KittenLife to get 20% off. Physical activity. Try to prevent your newly spayed kitten from exerting herself much in the immediate days after the surgery. No exertion means no jumping or chasing, or anything in between. Your kitty must have time to heal, and sutures must not be disturbed. Food. Unless the clinic keeps your little furball overnight for monitoring, she may resume eating the same day as the surgery unless your vet says otherwise. If your little buddy doesn't resume eating within 2 days after the procedure, consult your veterinarian. Aftercare. Unless the veterinarian gives you some specific instructions, you don't have to do anything about your kitten's post-surgery sutures. Just check on them daily to ensure they look clean. If you notice anything that looks abnormal, such as swelling or inflammation around the sutures, speak with your vet immediately. Also pay attention to symptoms you think might indicate an infection, such as discharge. Elizabethan collar. It is important that your kitty not lick the incision area. If she isn't ignoring the area, request an e-collar, Elizabethan collar, from your veterinarian. This collar helps prevent infection and other issues by preventing your kitty from reaching her sutures. Full recovery. In general, the incision will take up to 2 weeks to heal. After that, kitties should be as good as new, and you both can forget the whole thing ever happened. Using kitty litter after gets declawed. After your feline family member gets declawed, she'll require a little extra TLC at home. She'll need a litter box after surgery and can safely use cat litter, but you may need to make a few adjustments. Set up a safe recovery area and litter box before she returns home. Surgery details. Declawing your furry friend is a big procedure. During surgery, your veterinarian removes the last joint of each toe, including the nail. Typically, vets only perform the surgery on the front 2 paws, but in some cases, they can declaw all 4 paws. While you can declaw your kitty at any age, ideally the surgery is performed between the ages of 3 to 5 months, according to the Claws and Paws Veterinary Hospital. Kittens tend to heal more quickly than adult cats. Using the litter box. Your little purring pal will need a litter box with litter after surgery, just like she did before the procedure. For the first 7 days following surgery, her fragile little paws will be a little sore and you'll want to provide a different type of litter for her. Shredded newspaper or cat litter pellets made from the recycled newspaper are soft, comfortable materials for her to dig through in the litter box. It might help to get her acclimated to using newspaper as litter before the scheduled surgery. Newspaper alternative. Some kitties are finicky when it comes to litter and might not want to use the litter box if it has newspaper or pellets. If this is the case, you can safely return to her usual litter to keep her content. Fine-grained litters also have a soft feel for picky felines, explains the Humane Society of the United States. Use a clumping litter as an alternative to newspaper-type litter, since it has very tiny grains that are gentle for her sutured paws. Other tips. It may take several days for your fuzzy pal to recover. Put together a safe area for her, such as the master bedroom. Since it may be a little painful for her to walk, aim to keep her bed, food, and water relatively close together so she doesn't have to walk too far. Her litter box can be in the same room, but keep it on the opposite side as the food. Clean out her litter box frequently to minimize contaminating her open wounds. Lastly, keep her potty area away from noisy areas, especially while recovering from anesthesia right after surgery. If you enjoyed this video, kindly press the like button. Also, don't forget to subscribe with notifications on, so that you don't miss out on videos like this. Thank you for watching.